Right. So, hi friends. Uh, in this video, in the upcoming sessions, we're gonna start with central nervous system. Okay, we're gonna start with central nervous system. Under the central nervous system, I'll be covering the topics present in the anatomy, physiology, pharmacology, pathology, medicine, and you can look into these all the aspects, surgery, and the radiology. Under the central nervous system, I'll be discussing about the topic. Under the anatomy, I'll be discussing about the development of neural tube, neuroanatomy basics, CSF and ventricles, spinal cord, brainstem, cerebellum, cerebrum, white matter of cerebrum, basal ganglia, blood supply of brain. In the physiology, I'll be discussing about the sensory receptors, somatosensory pathways, vision, hearing, olfactory taste, descending motor pathways, spinal reflexes, cerebellum and basal ganglia, limbic system and hypothalamus, learning and memory, CSF, you have got blood brain barrier, ECG, and sleep. Under the pharmacology, I'll be discussing about the anti-epileptic drugs, sedative hypnotics, opioids. Then you have got an affect disorders, part 1, part 2, antipsychiatric drug, neurodegenerative disorders, alcohol and smoking dependence. And I'll be discussing regarding the pathology where CNS non-neoplastic lesions, tumors. In the medicine, I'll be discussing about the introduction to neurology, human brain, right, part 1. Right, you can get human brain, part 2. You got a language versus speech, memory, dementia, part 1 and part 2, basics of extrapyramidal system, Parkinson's disease, and you have gotten some park management, LMN part 1, LMN part 2, LMN part 3, and LMN part 3, 4, 5, GB syndrome, GB versus chronic inflammatory polyneuropathy. I'll be discussing about LMN approach, muscle part 1, part 2, inflammatory muscle disease, myasthenia gravis, LMN approach. On the anterior horn cells, I'll be discussing about the primary headache, dangerous headache, seizures part 1, part 2, spinal cord, where I'll be discussing about the anatomy. Compressive myelopathy, I'll be discussing about the spinal cord, clinical case example, spinal cord part 2, non-compressive myelopathy. I'll be discussing about the inflammatory demyelination of CNS, application to upper motor neuron lesions, blood supply of brain. Then I'll be discussing about the build-up to stroke, post-circulation. I'll be also looking into the brain stem syndrome, stroke management, surgery, head trauma, neurosurgery 1, neurosurgery part 2. I'll be discussing about the radiology where CNS, stroke imaging, trauma imaging, tumor imaging, infection and muscles. Right? I'll be discussing about all these topics in the further sessions with the concepts. Okay? Thank you.